Oh, hello. High blood pressure caused by pregnancy is known as pregnancy-induced hypertension. Up to 15% of pregnancies are complicated by PIH. The etiology of this disease is unclear. However, vasospasm is known to increase blood pressure. The condition has the potential to be very dangerous for the expecting mother and baby. An increase in blood pressure can decrease blood flow to the organ system of the mother. This decrease in blood flow can lead to placental abruption, which in turn cuts off the oxygen supply to the baby.
What are you doing with those?
PIH may also lead to a low birth weight and intrauterine growth restriction.
So, Taylor, have you ever had any family history of high blood pressure, especially in pregnancy?
You know, now that you mention it, I'm pretty sure my mom had high blood pressure when she had me and my two sisters.
And I know you are 18 years old, so you are on a little bit towards the younger side. So with those two risk factors, we usually like to watch you very closely for pregnancy-induced hypertension. Have you ever thought about trying yoga or relaxation techniques?
You know, I've always wanted to try yoga.
Oh, awesome. Yoga has been shown to decrease stress, which is directly correlated to blood pressure. Taking 1-hour yoga classes 3 times per week increases mental and physical wellness and decreases blood pressure. In a study, there are 2 groups. The control group received standard care and had PAH occur 36.7% of the time. The yoga group received standard care as well as the yoga intervention, only having PAH occur 10.7% of the time. This shows a significant decrease in the occurrence of PAH in pregnant women who do yoga.
Get back in there, I'm not ready yet. Not yet. Get back in there.
Providing education about the importance of relaxation techniques such as progressive muscle relaxation, guided imagery, and deep breathing exercises, as well as setting up a schedule to perform these techniques at home for 30 minutes every day has been proven to decrease blood pressure and pregnancy-induced hypertension. In an experimental study done in Egypt, the study group's average blood pressure of 142/92 pre-intervention was reduced to 127/82 post-intervention. No changes were seen in the control group. Another intervention that has been shown to decrease blood pressure in pregnancy-induced hypertension is a Mediterranean diet.
It's so nice we finally found the time to go out and eat together.
I know, we never see each other anymore. It's really great.
During pregnancy, you'll often hear the phrase "you're eating for two" circulating around. This is due to the fact that during pregnancy, the nutrition you intake directly affects the baby's growth and development. In one study, following 3,582 women, 8.5% of women reported hypertension disorders in pregnancy. Women who followed a Mediterranean-style diet, which included foods like vegetables, tofu, and fish, were found to have an inversely associated risk of developing hypertension disorders during pregnancy.
So you're telling me that even though I've been going to yoga and practicing my deep breathing, I still have high blood pressure?
I'm sorry, Taylor, that is what we're telling you.
So there are some options for you. One nursing theory states that pregnancy-induced hypertension may be caused by low calcium levels. These low calcium levels may cause a release of parathyroid-stimulating hormone, or renin, which causes vasoconstriction. Calcium supplementation is associated with a lower risk of pregnancy-induced hypertension, and it tends to be relatively low cost and have very few side effects.
That's good.
And the therapeutic dose hasn't been exactly determined, but generally 1 gram is where we'll start you at.
Okay.
Or another option that's available to you is antihypertensive medications. So a prospective study investigated the effects of antihypertensive medications on pregnancy-induced hypertension. So labetalol, which is a beta blocker, or alpha-methyl-dopa, which is an adrenergic agonist, were given to women with pregnancy-induced hypertension. Other women were not given antihypertensive meds and were just given the standard treatment. And so the results showed that women who received these antihypertensive medications had a lower risk of adverse maternal effects and fetal effects. So this is more positive effects for you and your baby compared to women who didn't take these medications. Women who took the medications had their blood pressure decreased by 30 milligrams of mercury for your systolic blood pressure, compared to only 6 for women who didn't take these medications.
Okay.
So these are just some other options for you to consider.
Okay, I'll definitely consider these and try them out.
So, despite our recent interventions, your blood pressure is still high. One of the things that we can try is bed rest. There is some conflicting evidence about it, but we could give it a shot to see if it helps.
Okay. In contrast to common practice and expert opinion regarding bed rest during pregnancy for the purpose of controlling blood pressure, there is surprisingly not substantial research evidence to support clinician prescription. The analysis of 4 randomized trials and a systematic review produced controversial statistics. Results showed that there can be anywhere from an 11% to a 62% risk reduction. That risk reduction must be balanced with the known risks of bed rest, such as thrombosis, muscle atrophy, and bone demineralization.
Hypertension is the most common complication of pregnancy. If left untreated, many further complications can occur, including preterm birth, placental abruption, perinatal death, acute renal and hepatic failure, hemorrhage, and maternal death. Interventions including yoga and relaxation techniques, diet, certain medications, and bed rest have been found to decrease blood pressure in pregnancy-induced hypertension. If hypertension can be controlled in the early stages of pregnancy when it is still mild, or prevented completely, the risk of developing these complications can be reduced, making for a much safer pregnancy. However, the only true cure for pregnancy-induced hypertension is delivery of the baby.